Good morning, everyone. It's a pleasure to have you here in Cyprus. It's with pleasure that I want to call Dr. Shushan Hovsepyan from Armenia, a pediatric oncologist, to present. Thank you.
Good morning, everyone. Sorry for technical details. I'm Shushan Hovsepyan, a pediatric oncologist from Armenia and the co-chair of Cy-IAPCC Global Health Network Research and Innovation Working Group. And it's a great pleasure for me to be here and share my expertise, share our story of Armenian pediatric oncology with you. But before that, I would like to, it's not working still, but I would like to give you an outside look of Armenia. It's a small country, 3 million population in South Caucasus. We have a huge history of culture, sports, food, and also pediatric oncology. I'm sorry, but the slides are not going. Yeah, so just an outside look of Armenia. And as my mentor, Professor Gevorg Tamamian, always says, we are a small country, but we have big ambitions. So let's start with the challenges. Not long ago, we had a survival rate of 0%, no protocols, few pediatric oncology specialists, no radiation therapy. And what we did, our senior pediatric oncologists implemented the German protocols and for leukemia patients, and the survival rate went up to 70%. And in 2019, we unified all pediatric cancer units in the country, and now we have the Pediatric Cancer and Blood Disorder Center of Armenia, which is accepting 100 patients per year. And the survival rate currently is 75% and above, which is a very high number for low middle income country. Funding, of course, funding is always an issue, especially if we have low number of patients. Big organizations are not interested to fund. So what we did here, the City of Smile Foundation, which is a charitable foundation, came to help us. And right now, 100% of our care is provided by City of Smile Foundation from 0 to 25 years old, and some governmental support. And 0 child stays without treatment because of money issues. Data, of course, we need data to do research. So what we did, we collected 25 plus years data from archives, and now we have the electronic registry. Lack of specialists. We all know that pediatric oncology is not so fascinating profession to choose, but in Armenia, in 2019, when we created the center, we had the highest number of fellows in pediatric oncology and hematology department in the whole country, and if you see comparison with US, again, it's very high. Guidelines, what we did. So Armenian is a separate language family, and it's not similar to any other languages. What we did, we adapted and translated all the guidelines for all tumor types, both for pediatric oncologists, for patients and families, and also for primary care physicians. We created working groups, multidisciplinary working groups in leukemia, lymphoma, solid tumors, sarcomas, and neuro-oncology, and our teams are working and discussing cases on daily basis with experts of the field, sending materials for second opinion, and so on. Bone marrow transplantation. This was a very huge issue for us because we didn't have that opportunity, and the patients had to fundraise money, had to go abroad, huge financial burden for families and also for the country. But we implemented a bone marrow transplantation unit, and now we are providing also allogenic transplantation. And we had a very interesting story where renowned Professor Scott Howard contacted us because there was a patient in Latin America, in Guyana, who needed bone marrow transplantation, and they applied to St. Jude, NIH, because of logistic issues that was not possible to do, and here Armenia smiles. We accepted the patient received bone marrow transplantation successfully. Palliative care. As we didn't have a palliative care unit, we had to send patients home, but with the help of City of Smile Foundation, now we have a 5-bed unit equipped with all necessary things that is required for palliative care. Clinical trials. This is the biggest problem, not in our country only, but also in the region. But we found also one solution. Right now, we are launching a clinical trial, which is a multi-center trial in 27 countries in POEM region. And the PI is our head of department, Rosanna Papian. It's in osteosarcoma patients. Current programs, what we have: psychosocial program, predisposition clinic, survivorship clinic, cancer rehabilitation center, and also ongoing pediatric immunology clinic, center for hemangiomas and vascular malformations, and AYA clinic. Current challenges: we have we have a limited access for high-cost medications, immunotherapies, but I always say yet because the time comes and we will have that as well. And of course, we need more trials. But this is a work of a huge team, and I always say that there are a lot of challenges worldwide, but the most important thing to find people who are ready to implement the idea, and these people are the change makers, people who dream big. And speaking of dreaming big, on February 15th, on Childhood Cancer Awareness Day, we are organizing the second Global Oncothon, which is a 24-hour telethon, and which aims to raise awareness and funds for pediatric cancer research, and the funds will go to Cy-IAPCC, and then Cy-IAPCC will distribute it as a research grants, career development awards. And this year we have a very high representation, celebrities as well, so Richard Gere and Alejandra, Messi. So please stay tuned also for February 15th, and some of them are speakers I know on this event. Thank you.